Text Converter by Symmex is a unique and powerful solution for healthcare professionals in any department, clinical or non-clinical. Its easy-to-use data extraction features make it possible for anyone to quickly capture data from any reports to combine and manipulate into the formats they really need. The hours spent by individuals who are retyping and copying and pasting data will be reduced to a fraction of the time, saving you hundreds of thousands of dollars per year, getting them back to what they're really intended to be doing, patient care. The reports used within your healthcare organization are endless, which means Text Converter's benefit in extracting data from those reports is also endless. Text Converter has been proven in extracting information from many reports in formats of all levels of complexity from all kinds of hospital systems: scheduling and registration, clinical patient care, coding and financial, patient follow-up, operations, and others. The data from these reports is resorted and separated into work lists, summarized for comparison and trending, used to track clinical initiatives and improve performance, to create financial projections, reconcile and balance systems, track information for regional and national reporting requirements, and to monitor productivity and resource utilization to maintain accountability. A modest estimate of the benefits of using Text Converter by 50 users over the course of a year shows significant savings, but there are some individuals who spend even more time producing reports in this way, where the benefit would be even greater. Imagine spending minutes instead of hours to complete your reports with 100% accuracy. Contact Symmex today to see how Text Converter can help breathe life into your data. Ask for a free demo and trial of Text Converter's uniquely powerful data extraction features and experience our proven, result-driven customer service. This is a demonstration of how Text Converter 4 can be used to quickly convert a report that is formatted with multiple levels of data into a single table of live data. We start by opening the report file. We set the output fields that will hold the extracted data. Our detail extraction level is patient charges, so we assign the name charges to this template. We right-click on a line that contains a sample of the charges to be extracted and select the option Set Up Template from this line. The values at this level are identified and selected. We then link the selected data to the appropriate fields in the output dictionary. We right-click on the parsing view of the report file again and select the option Add Top-Level Template. Patient information will be extracted at this level, so we name the template Patients. We right-click on a line that contains the appropriate data for this level and again select Set Up Template from this line. For this template, data is being selected that is not appropriate, so we must change a couple of options to ensure that it only selects what we need. We do this by changing the data type for one field and changing the Can Be Empty option for another field to No. This produces the desired result. So we link the items for this template to the appropriate output fields. Now we created another top-level template following the same steps as before. This template will capture department-level information, so we name it appropriately. In this template, we can use the label directly to the left of the value we need as a tag to consistently get that value. And we again link the value to the output. We then create another top-level tag-based template to capture the period ending date using exactly the same steps as the previous template. The last template will capture the facility name. It is started by adding a top-level template and assigning a suitable name as before. It also uses the Setup Template from this line option that was previously used. In this case, however, it will need to be filtered to only use information from those lines that contain certain text in the first selected field. The text to be used is highlighted and copied. We then go to the Include option of the input field properties and select Mask. For the Include Mask property, we paste the previously copied text. The parsing preview indicates the selection of the correct data. Linking the final field completes the data. Data from all templates has been selected for each output record and is ready to be exported to wherever you need to use it.